The coroner's report came out again. 179 people died in October of drug poisonings. Looking at other numbers, BC Ambulance responded to 35,000 overdose calls last year. I'm wondering whether you have spoken with Premier Eby on your visit here about looking at safe supply and bringing in safe supply to combat this drug poisoning crisis.
Yes, I had a good conversation about it with the Premier just now, but we're also working very, very closely through our ministers and appropriate officials to continue to move forward to counter this horrific opioid epidemic and drug poisoning epidemic that is facing people not just in vulnerable communities, but in suburban and large and small cities across the province and across the country. We know that anchoring ourselves in science and data, making sure that issues of harm reduction, safe consumption are put to the forefront. We were happy to move forward with BC in landmark steps on drug supply just a number of months ago, but we know there's much more to do, and we will continue to work hand in hand with the province on leading in making sure that people are kept safe. We know, unfortunately, that conservative politicians continue to disregard science, disregard data in their approach on these, as unfortunately the Leader of the Opposition reminded us in an incredibly ignorant video just a few weeks ago. But on this side, with thoughtful partners like the Government of BC, we will continue to be grounded in what works, in compassion, in evidence, and in keeping people out of the justice system and focusing on addiction as a health issue. But I'm happy to turn to Premier for a few words on this.
Thank you, Prime Minister. We know that addiction is a health issue, and supporting people struggling with addiction, keeping them alive and giving them an opportunity to get into treatment, to turn their lives around is essential. I'm really glad to have a strong partner in the federal government on this issue, supporting BC and taking the steps necessary to support people to keep them alive so that they have that opportunity to access treatment. And we have a lot of work to do in our healthcare system, which was key in our conversations, and mental health and addiction responses as part of our public healthcare system, making sure we're supporting people and families. I've already talked with too many parents who've lost kids, too many families who have been hurt by the overdose crisis, and British Columbia will continue to do everything possible to address the toxic drug supply and to support people struggling with addiction and address this issue in our province.
I wonder if you have a timeline on that, whether people can see this happening quickly. There's a crisis going on.
So British Columbia has led the way nationally in responding to the opioid overdose crisis, the toxic drug supply crisis that we're facing. We've had an important partnership with the federal government to try to separate people from those who are selling toxic drugs and get them connected to drugs that are not going to kill them, that are going to keep them alive. As part of my public safety announcement just a week and a half ago, talking about a new model of care with St. Paul's at Providence Healthcare, where people who show up in the emergency room recovering from an overdose can go immediately from the emergency room to detox to treatment. So when they have that moment of clarity, that we can grab them and support them in building a new life. This is what you'll see from our government: continued work on this essential and important issue, and an acceleration of our work wherever possible to end the needless deaths that we're seeing.